This is the injury report presented by NYU Langone Health.
Malik Nabers has been completely cooking all throughout training camp, but both he and the Giants training staff are going to have to manage a toe injury that he's been dealing with since his days at LSU. So in today's injury report, we're talking with Dr. Daniel J. Kaplan, sports orthopedic surgeon at NYU Langone Health, because we need to know what Nabers needs to or how he's going to protect that toe throughout the season. All right, Doc, they held him throughout minicamp, OTA practices. No toeing the line on this one. Be 100% with us. He's been absolutely cooking throughout training camp. What exactly is turf toe? I've heard that a lot throughout my time in the NFL, but what does that mean? And like, how is something like this treated?
Toeing the line. Nice pun there. Great
Thank
job.
you. Thank you.
So turf toe. So that's hyperextension of the big toe. So that means if this is the big toe, it's getting pushed backwards. And it's called turf toe because what happens is the foot gets stuck, the toe goes up, but the rest of the foot doesn't. What it does is it causes disruption of something called the plantar plate. So that's a ligament on the bottom of the foot that's supposed to hold something called the sesamoid bones, or these two little pebbles on the bottom. They act as pulleys, and they're what lets us flex that big toe with power. So since he's a professional football player who relies on explosiveness and you get that push off from the big toe, this is something that can lead to pain or weakness and cause a problem.
One of the most explosive receivers in the game. So I can see why this is something that hasn't gotten better, especially when you see him put his foot in the ground and go up for the football, which he does so well. He even said that on a show one time that when he's talking about the pain or this toe, it's like a mosquito that won't go away. Again, he's been dealing with this, Doc, since his time at LSU. Is it normal for an injury like this to take so long to heal?
Yeah, so you nailed it. So ligaments are poor blood supply. The plantar plate is a type of a ligament, and someone like him is putting a tremendous amount of strain on it. Like, he has such power and such explosiveness. Every time he puts a step, he's just stressing that ligament, giving more micro tears. So it's not, abnormal for it not to heal with someone like him putting that tremendous amount of force. He does have great medical staffs, both at LSU and now in the pros. So I'm sure they're giving it, all the respect it needs to try to heal it. But this can be, like he said, this nagging injury that just doesn't go away. And that's what he's been dealing with.
We're talking about a kid that had 109 catches last year as a rookie. He's going to get his targets. Russell Wilson loves throwing the football to him. So if this is something that's not getting better throughout the course of the season, is surgery an option? And if he does get surgery, what would that do?
Yeah. So the treatment for this totally depends on the severity. So there's three types of grades 1, 2, and 3. We keep it simple because orthopedic surgeons are pretty dumb and we can only keep things very narrow. Grade 1 is just a little bit of a stretch. Grade 2 is a partial tear, and grade 3 is a complete tear. So the lower grades, the grades 1 and 2, the partial tear, the strain, those treated non-operatively, some time, some taping, some hard-soled shoes. Grade 3 with a complete tear is when you start talking about surgery, like you alluded to. And as far as surgery goes, it really depends on those little bones, those sesamoids, that pulley. If they get torn and they're pulled back, that's pretty much guaranteed surgery. If they're torn, but the bone stayed in place, that's when you can try to fight through it. I don't know his exact condition. I haven't seen an MRI. My guess for him is that non-retracted tear. Surgery can be done to fix that ligament and hold those bones in place if needed.
All right, so if he had to get surgery, which every Giants fan that's watching this right now is like, please don't let it come to that. How long would his recovery take?
Yeah, so for someone like him, usually return to sport 4 to 6 months. So if he ends up getting that surgery, that's going to be the season for him.
AKA the Giants season. All right.
AKA.
So this is something that, yeah, again, Ronnie Barnes, I've known him since my rookie year, head trainer for the Giants. I know it's something that they've been on top of. And, hopefully it's a situation where they protect the player from himself as well, because Malik is a dog. He wants to be out there. $1 million question here, Doc. Do non-professional athletes ever have to deal with turf toe? And then two-part question to that part. Do they even call it turf toe, and how would they manage it?
So the $1 million question is definitely not, do we get turf toe? It's going to be what happens to Malik in his surgery, but I'll respect it for the non-athletes because everyone else watching. Yes, non-athletes or non-elite athletes like myself, we do get turf toe. We do call it turf toe because that's what people are, familiar with, but it's usually not from, a turf. It's basically anything that your foot gets planted and your toe is going to get forced up and tear it. And the treatment would be the same. So for those, partial tears, strains, we would try to treat non-operatively. But if it's a full tear and it's causing problems, we would get surgery. The main difference, the main thing that always happens between us versus professional players is just the staff around us. So while someone like Malik might be able to return in 4 to 6 months with that incredible training staff the Giants have, medical staff the Giants have, for us, it'd probably be closer to 6 to 8. But the treatment would otherwise be the same.
So if you're not a professional athlete, watch out for the bottom of the coffee table because that can really mess that toe up. I've stubbed that a couple times, Doc, so it can happen to anybody. Man, this was fun, man. Appreciate you jumping on with this, Doc.
Yeah, always good to see you. Thanks again for having me.